Hello, this is the second part of this clip that you may have seen when I'm wearing the same clothing. And I was cut a little short. I was saying that there were quite a few interesting things that should be considered as far as treatment in the future. I was mentioning the possibility of culturing the unaffected white blood cells and transfusing them into the affected donor. That's a possibility for the future. Also, in addition, some interesting things which, because my numbers have been so low, these are some observations. I've seen children that are newborn with the pharynx that is somewhat small and that are constipated and have night sweats, and these children being 3 or 4 weeks old, and the parents having the pharyngeal swelling and the symptoms of the fibromyalgias, restless legs, and chronic fatigue seem to have been able to transfer this virus to the child. It leads one to suspect that more damage may have been done, and because of all these autistic children that are arising, and the children that have been diagnosed with attention deficit disorder, this should be considered something to look into. Also, other patients, once again, I have not had the numbers, but patients who I've seen with this disease, and who also have a coexistent chronic hepatitis after starting with the vitamin C and B and the protein. I've seen their lab reports with their liver enzymes normal. This has to be, that's a consideration, something to look into. Once again, I should stress that this is up to you, the listener, to take into consideration, and very important, if you start the vitamins without an antibiotic, you might feel somewhat woozy. And it seems like that what's going on is you're killing off bacteria, but very slowly. Occasionally, when you start the patient on Levaquin, he might experience something like that, and receive phone calls with a complaining patient saying that he felt that he had a terrible reaction to the Levaquin. What seems to occur is Levaquin is bactericidal and kills bacteria quickly. It's one big whammy, and because one is a human culture medium, the bacteria just are within the blood, and the dead bacteria and the excreta have nowhere to go but the blood. Usually when this happens, the next day or the day after, the patient states, "I haven't felt this great in a long time." Then is the time at that point is the time to start taking the vitamin C, the vitamin B, the protein, and the zinc. And well, I'll leave you with this for the time being. There's quite a few things that that are in the back of my mind, and since it's unscripted, these are just certain details that I've memorized. So, God bless. I hope you all do well. I know you all will do well, but I can't recommend this thing. You also have to eliminate the other possibilities, such as lupus, rheumatoid arthritis, diabetes mellitus with neuropathies. There are quite a few things that one has to eliminate, but the numbers are so vast with this virus that it's incredible, and therein lies, I'm sure, the what I'd say is overprescription of anxiolytics, analgesics, antidepressants, and the exams that are the colonoscopy, CT scans. It's just unbelievable. This can be simplified much more. The cost to the country, I think the cost to the country because of this virus is extraordinarily high. So, but somebody will find out soon enough, hopefully. Well, please spread the word to friends. Oh, another thing that comes to mind, I have so many scattered little things coming to mind, is I'm pretty sure that that part of the Gulf War syndrome is related to this. The other part is the plutonium tipped bombs, but part of the Gulf War syndrome is part of this. And in those years, the waves of this chronic fatigue thing were horrendous. It felt like a ton of bricks fell on your back. And incidentally, in this area, it started after malathion spraying for the fruit flies in Los Angeles. Within months, I started seeing quite a few people. I can't say it's due to that, but these are things to take into consideration. Another thing that's worthwhile taking because one has bacteria in one's blood, and there is an increased acidity, and those getting up at night to go to the bathroom with small amounts of urine produced is usually acid urine. I usually tell my patients to try something like Gerolsteiner, which has a high degree of bicarbonates. We had Vichy water from Spain or France. That has a much higher content, and one does notice the difference. The thing is to maintain yourself hydrated. If you take tap water, it doesn't stay so long in circulation. Anyway, stretch your muscles and don't overdo it for a month, and I'm sure you'll all be well. Okay, I'll get back to you later on.